White feet don't treat is a warning based on an old belief that dogs with white feet would actually metabolize certain medications differently and therefore have very severe and significant side effects, including expiring. The ABCB1 gene, also known as the MDR1 gene, the multi-drug resistant 1 gene. That gene is responsible for coding what is called the P-glycoprotein. When a dog and a cat, we now know this, has an MDR1 gene mutation, they are more sensitive to certain medications because they lack the P-glycoprotein, which is a pump of sorts that protects cells from the medications given and helps them get excreted from the body. So without that P-glycoprotein, the medications we administer have a more serious effect on the pet and actually breach the blood-brain barrier. What does that all mean in real terms? It means that certain dogs with this MDR1 mutation, when they are given certain medications, they will have ataxia, which means that they will walk like they are drunk. They could have lethargy, vomiting, they could have seizures. And what breeds are included? Well, typically we think of herding breeds. So collies have as high as a 70% occurrence of this mutation. Australian Shepherds also do, Old English Sheepdogs. But frankly, any dog and cat, don't forget the cats, can have this gene mutation, which would lead to significant side effects from medications, certain medications. And a lesser known category of medications would be the antiemetics or anti-nausea medications like Cerenia and Zofran. Don't let Huck's adorableness distract you from the story because this is important. He is a 2.5-year-old American Pit Bull Terrier. When he was a puppy, we did his embark testing and it came back 100% American Pit Bull Terrier. What we also learned from the embark testing was that he had a copy of the MDR1 gene mutation, but he only has one copy, so it puts him at a slightly increased risk of being sensitive to certain medications. Huck's mom works at our animal hospital and he often comes to work with her. His mom mentioned to one of our doctors last week that he really dislikes being in the car and seems kind of nauseous. The doctor she talked to about his aversion to car travel recommended Cerenia because it is labeled for motion sickness for dogs. On Wednesday morning, she gave him a dose of Cerenia before they left the house. Wednesday during the day while he was at the hospital, he was acting a little punky and had some soft stool. Thursday, he refused all food and was acting really lethargic and just not himself. I mean, look at this beautiful boy. He is playful. He's usually a really happy, spunky kiddo, and he didn't want to have anything to do with anybody or any food. Friday, he bounced back a little bit. He stayed home that day with Dad and was okay, not himself, but okay. Saturday morning, Mom called me to report that he was absolutely not interested in food. He was super lethargic again and just acting really punky. Still, no vomiting, no soft stool, no other symptoms, just acting really lethargic and acting like he did not want to eat, like he was queasy and he had some stomach gurgling. We did x-rays and blood work. Everything was boring, thank goodness. And then I realized all of the symptoms started after she gave the dose of Cerenia for motion sickness. So we decided to treat him as if he was having an MDR1 medication reaction. We gave him some fluids, which you can see he's such a good boy. He's getting his sub-Q fluids here. He has recovered and is eating and back to playing and being his normal, goofy, loving self. We will be doing specific MDR1 gene mutation testing through the vet school at Washington State University. I will have a link to that website in my link tree. It is a fabulous resource. And actually, if you really wanted to know what's going on with your pet before you administer any medications, especially for cats who get flea and tick medication, you can order a kit. It's $70. You can do the testing at home. It's a cheek swab, and they send you the results, and then you have the results, and you can communicate that to any veterinarian taking care of your pet. The other big takeaway is cats can have this mutation as well. And ironically, did y'all pay attention to Huck's feet? Did you notice what color his feet are?